committee for arranging this event. So my name is Kartika. I'm a second-year DPhil student under the Center for Tropical Medicine and Global Health in the Natal Department of Medicine. So today I'm going to walk you through my project titled Distribution of Scrub Typhus in Indonesia, a scoping exercise. Just to be more dramatic, mapping the mysterious mite-borne microbe. So this is one of the most iconic photographs from the World War II era in the Pacific. This man is an Australian soldier who got wounded and temporarily blinded, and he was guided walking by a Papuan. So that soldier, he recovered from the wound and returned to his unit, but he died 7 weeks later because of scrub typhus. So not only this soldier, but scrub typhus has caused significant casualties in the Allied troops when they landed in West Papua. But we know next to nothing about the distribution of it in Indonesia. So what is scrub typhus anyway? So scrub typhus is an acute febrile illness, which means it's causing fever. It is caused by this bacterium called Oriensia tsutsugumushi, and it is spread by this mite, a chigger mite. So when they feed, so this mite will attach to your skin, and then it will use its saliva to liquefy the tissue, and it feeds on the tissue fluid. And on the side of mite inoculation, you might find this thing. It's called eschar. It's basically dead tissues in the form of black scab. But well, actually, eschar is a quite specific sign of scrub typhus, but its presence is variable. It can range from 7% in one population to 97% in other populations. So it's not really a reliable sign to diagnose scrub typhus. And the gold standard for diagnosing scrub typhus is also imperfect. So it's a challenge to diagnose this disease. And it is also potentially fatal with up to 70% mortality if it is untreated. But it is actually treatable with antibiotics, but you need to know which one to give and to give it promptly. So understanding disease distribution is very important because we need to know when to consider it as the diagnosis, and then to be able to administer treatment, antibiotic, promptly and reasonably. Through my PhD project, I wanted to understand the disease distribution in Indonesia using approaches that are applicable in resource-limited settings, given the challenges. So this is the first approach I'm going to use. It's like fishing with a net. I'm going to throw the net in the databases and in the libraries and through my contacts to find relevant evidence. I'm going to gather everything, summarize, analyze, and map them to understand what we know about scrub typhus in Indonesia. So I'm going to use this approach in my first sub-project. In case you haven't heard of systematic review, it's basically a method to do review systematically, just to avoid cherry-picking evidence or biases that can cause unbalanced review. So with this systematic review, I wanted to assess the feasibility of establishing an individual participant level data platform. So why an IPD platform? So data in low middle income countries are often fragmented, of suboptimal quality, or very heterogeneous. So it is very difficult to make sense of them. So if we have data from each and every one of the patients, we can standardize them, and then we'll be able to pull them together and perform larger statistical analysis with bigger size. So, but we also will retain the granularity of the data because we have data of each and every one of the patients. This project will be done in collaboration with the Infectious Diseases Data Observatory. Then the second sub-project with similar approach, I'm going to map the evidence. So with this map, I'm going to gather the evidence, and then I'm going to rank them and give scores to them based on the level of certainty of the presence of the bacteria and the vector, and that is infectious to humans. With this map, I'm hoping that we can identify areas with gaps of knowledge and data, and then we can direct future studies there. So Indonesia will be divided into subnational areas. And then I'm going to assign scores to each of the areas. And then the scores will be translated into colors, like the reddish and color. This is the algorithm I'm using, so you don't really need to read this. So this is a preliminary results. So Orientia Tsutsugamushi transmission is documented in at least 3 major islands in Indonesia. Yeah, Tsutsugamushi is Japanese because that's where they first identified the disease. So it was documented in at least 3 major islands in Indonesia so far. So Papua, Sumatra, and Java. And the seroprevalence is variable from 0 to 20% with median 4.9%. I'm going to explain what is seroprevalence in the next slide. So this is the second approach I'm going to use in my PhD project. So seroprevalence is the proportion of population that have scrub typhus antibody in their blood. So antibodies it's like footsteps. It's like trail that's being left by the bacteria. Because when you're being exposed with the bacteria, your body develops antibodies. So it's a proxy of active transmission. So for detecting antibody, we're going to use this technique called enzyme-linked immunosorbent assay. So this plate will be covered with scrub typhus antigen, and then we're going to add the part of the blood of the patient, and then see, and the scrub typhus antigen will attach to the scrub typhus antibody will attach to the antigen, and then we're going to add an anti-antibody that will attach to the antibody. And this anti-antibody is linked with an enzyme, hence the name. And then we're going to add a substrate that will react with the enzyme and produce a color change. This color change is measurable with this machine, a spectrophotometer. So we can tell whether the patient has the antibody or not. We're going to test archive fever study sample. It basically means I'm going to test leftover samples from previous studies on fever. But I'm also going to get some samples from palm oil, from population in palm oil plantation area and compare it with the urban settings. Why palm oil plantation? Because in Malaysia, it has been shown that scrub typhus is a common cause of fever in palm oil plantation areas. So we wanted to see whether it is the same case or not in Indonesia, and if it is, we can raise awareness in palm oil plantation workers to prevent scrub typhus. Thank you. That's all my presentation for today. I'd like to thank my supervisors and everyone that has helped me go through this.